Hey everybody, welcome to the first GRadulting workshop of the semester. My name is Debbie and I'm the coordinator of programs and services for Graduate Student Legal Aid. I'm glad you joined us today. We have two terrific guests who are here to share information that will hopefully help you choose your health insurance plan. Not a fun task, but a necessary one. So in a few minutes, I'll be putting some instructions into the chat, so just keep your eye out for that. This semester, we have 9 GRadulting workshops. They are all on Tuesdays at 12:30, and they will usually be recorded. Each week, we will address a new topic with a new speaker. You won't want to miss out on next week's workshop. The topic is life hacks. And your fellow grad students have shared their life hacks. And these hacks address everything from saving money and being organized to time management, cooking, and lots more. So it'll be a really cool workshop, and I hope that you can attend. Outside of the GRadulting Workshop Series, our office provides legal services. So our attorney and director, Zach Mundy, is here today, and he's going to tell you more about that now. Take it away, Zach.
Hi, everybody. As Debbie said, I'm Zach. I'm the director of Graduate Legal Aid. I really appreciate you coming, and sorry for the little mix-up. Things we learned during our first GRadulting is that make sure that if you are requiring authentication for your Zoom meeting, that everybody is a UMD student, but you're going to meet Dave today who's not, and that was our hiccup. But first, Robyn Kotzker is going to speak to you. She works for the UMD grad school. She's a program manager in fellowships and awards. And she's also in charge of the new grad school health insurance policy. And the policy, as you guys may know, requires full-time enrolled graduate students to have health insurance. Robyn works closely with the academic health plans, AHP, which services the UMD SHIP plans, the student health insurance plans. On the other side of that partnership is Dave Usher, who you can see. He's the senior account executive for the academic health plans, or AHP. And Dave has more than 25 years experience in the healthcare industry and 15 years in student health. Prior to AHP, he worked for Blue Cross Blue Shield of Massachusetts and the Tufts Health Plan and Merck Pharmaceuticals and Aetna Student Health. He's kind of been all over. He's worked with education of all sizes to develop creative healthcare solutions and has a wealth of knowledge and is presented on various student health topics and seminars throughout the country, including for the American College Health Association. And while at the University of Massachusetts, he also earned a degree in economics, specializing in government finance and public policy. So you have two great speakers today who have a wealth of information, both on the UMD side with Robyn and Dave, who seems like he's done it all in the student health insurance field. And so we're really happy to have them, and we're really happy to have you. And with that, I will pass it off to Robyn and get the workshop started.
Great. Thank you, Zach. Thank you, Debbie. And good morning, or good afternoon, everyone. Welcome to this session on health insurance. This has been a new venture for the graduate school. We now require health insurance for graduate students. Anybody who is full-time enrolled in graduate school at College Park is required to have health insurance. And we did this because maintaining your health and well-being is extremely important. If there's something that goes wrong, if you get sick, or if you get injured and you need care and you don't have health insurance, the cost of that can be really high. You might have heard stories about that, and believe me, the stories are true. If you don't have health insurance, then the cost of getting health care in the United States is extremely high. So selecting a plan can be daunting because understanding health insurance terms and understanding what a plan does for you and all of that might be new to you. So we understand that, and that's where Dave will come in. He's going to come in and talk to you about terms and what the student health plan can offer you and things like that. I'm here to assist you understanding the graduate school health insurance policy and the steps you need to take to make sure you comply. The main step is to get health insurance, but then there's other steps involved with that with regard to like reporting the information. For example, if you get the student health plan that Dave is going to be talking about, the university student health care plan, you would do it through his website. And by doing so, I have that information. I just simply know that you purchased health insurance. And so there's nothing else you need to do. All you have to do is simply purchase that health insurance plan. Other options available to students include purchasing insurance from a different source, and that's okay. You can purchase insurance from any source, but if you do purchase it from an external source from UMD, we would need you to report that to us. And we have a form for that. That's also on the Academic Health Plans website that Dave manages. So those are the kinds of questions that I can help you with, how to make sure you comply with the policy. But you're here to learn about health insurance a little bit more, so I'm going to move on to Dave and let Dave start his presentation about health insurance terms and plans and things that can help you make your decision about how to find health insurance.
Great, thank you so much, Robyn. Just bear with me for a second while I share my screen. Oops, did that not share? Can you see that now?
Yes.
Yeah, we could see it.
Great, okay. Thank you. So I appreciate that, that introduction. I have a lot to live up to now. I will be talking to you today about basic insurance terms, how they apply to the school-sponsored plan, which is through Care First, or the local Blue Cross. And then I'll talk about some insurance highlights as we see them, and then important documents. Hopefully there'll be some time for question and answers at the end if need be. We've mentioned academic health plans a few times. We are the administrator for the program. So we handle basically everything but the claims administration for the school. We work with over 200 universities throughout the country, and that's all we do. So we feel like we're specialists in this, and hopefully we can give you our insight here. Oops, what did I do? There we go, sorry about that. So we'll start off with basic terms, as I mentioned. So the basic terms, probably the first one that people hear about is the premium, and that's what it costs you to get the health insurance. I will say that in student health insurance, it's typically less expensive than you're going to see in the employer world, and certainly more, certainly less expensive than you would see in the federal exchanges. The annual premium for the University of Maryland is $1,555. To give you an example, I mentioned we work nationally throughout the country. We're looking at probably $2,200 to $2,500 for a plan. Now, not all the plans are the same, so that's a rough number. But I will say that it's priced. It's a good price there. That's why I wanted to point that out. Another common term that you'll hear is deductible. You may not think about that so much as far as health insurance goes, but I think people are probably pretty familiar with that when it comes to car insurance. So the way that works typically with car insurance is you may have to pay $500 upfront, so it's the money you have to pay before the insurance kicks in for the year. Now, don't fret, it's not $500 for the UMD plan, it's only $250, and that's the first amount annually. If we talk about co-insurance, that is the percentage that is paid either by, depending on which way you talk about it, by the student in this case, or by the insurance company. I will talk about this by the student. So you would pay 20% after you've met the deductible for services that require the deductible for the plan year. There's also a good term that's not on here, which is out-of-pocket maximum. Out-of-pocket maximum applies to the co-insurance, And when you have paid $1,500 out of your pocket with this plan, everything for the remainder of the year is covered at 100%. So that's a nice peace of mind that you have there that that has built in, and that's far lower number than I see at a lot of other schools. So it's a good service that UMD has provided there. And the reason I say that is because we work with both the carrier and the school to come up with what the school wants, benefits versus cost. So they want something very cost effective, but also the best benefits that they can find. And I think they've done a nice mix of that here. The last bullet on this page is copayment. Copayment is what you typically hear with a prescription drug. So you may go in to get a prescription drug, you may pay, say, a $20 copayment, that's all you need to pay, and you receive your drugs. So as I mentioned at the top, this plan is with Care First or Blue Cross. I'll use them interchangeably, the Blues, Blue Cross Blue Shield, Care First. And then if you go down the bottom, I mentioned some of these specifics: $1,555 annual premium, yearly deductible of $250. Co-insurance, which is your part of the responsibility, is 20%, 80% being paid by Blue Cross. A typical office visit copayment, there's no co-insurance involved with that. You just pay $25. But if you go, the important part here is, and I know it's a weird year where not everyone's on campus and what have you, but the University Health Center offers a lot of good things, and the services there are covered with no deductible, and so $0 for you to go there and get services. As far as a lifetime maximum benefit, I'm going to talk about a couple of these things, and those of you that may know a little more about health insurance realize that when in March of 2010, the Affordable Care Act was passed. Some people call it Obamacare. That really changed the landscape of how some of these plans were looked at. In lifetime benefit maximum, they used to be able to limit the amount that they would pay out. So God forbid you had something serious like a cancer and you had ongoing treatments, and during the year you'd rack up bills and it would be $500,000, and then you wouldn't get benefits after that. That is not the case with Affordable Care Act compliant plans, on which this plan is. So you do not have a limit on the benefits that you could get. So again, I would wish this upon anyone, but if you have a lot of bills, you would still continue to get payments. There's no cap on this. Then when we talk about network benefits versus out of network, this particular plan utilizes a preferred provider organization. So it's Blue Cross's PPO plan, what we call them. So what that is really the best of both worlds. You have the benefit of an in-network, going to an in-network doctor, which is the most cost-effective for you. It works similar to an HMO if you think about getting the best cost value there. There are no referrals involved, so that is not the same. And then the other piece of it is the out-of-network benefit. So you can go to, now you have the choice. So you have not only the cost savings, you also have the flexibility to go out of network if you want, which potentially you would pay, instead of the 80% coverage or the 20% that you need to pay, you would need to pay 40% to have that benefit of going out of network. I will say that there is a very robust network for Care First in Maryland, so it would be somewhat difficult for you to find someone locally that is not part of it. But as this is a nationally covered plan, so for instance, if you are taking classes remotely and you're in another state, you would still have in-network benefits that you could receive from your local Blue Cross provider. So all you need to do is find a participating Blue Cross provider in whatever state you are in, and you would get in-network benefits. But some people need specialized care, or for instance, the Mayo Clinic is quite famous in Minnesota. I don't believe they accept insurance there, so meaning they don't participate with anyone. So that would be part of your out-of-network benefit if you needed to go there. So we do have tools for you to look that up and see what providers are in network in your area. You can do by zip codes. Like I said, if you're out of state, that covers you as well. So we'll move on from there, talk about some insurance highlights. As I mentioned, there's really some robust benefits at the University Health Services. Here's just an example of some of these here that you can get right there if you happen to be on campus. I'll talk about mental health parity is another thing that came in with the Affordable Care Act. And what this means is mental health services used to be able to be paid at different amounts than physical health. So now they are to be covered the same, which they are under this. And mental health and behavioral health services are considered essential health benefits. I use those particular words because those are the words that the government used when they called those out in the ACA plan. So again, if you look at the health center, it covers a wide range of things. You can get your benefits there as far as behavioral health services, there's crisis intervention, medical management, services for ADHD, etc. But I would encourage you to talk to them if you feel like you are in need of any of that. Preventative services, again, so most plans, look at the second bullet there, most plans must cover preventative services without charging you a copay or coinsurance. So these are, again, essential services that are to be provided, covered in full, or at 100%. I will tell you as well, if you happen to have dependents on your plan, ACA does include preventative pediatric dental on the plans as well. So that's included with this. And, you know, just a tip when you're going into your doctor's offices, say for a physical or what have you, you can certainly talk to them about what's covered and what should be part of this preventative. So, you know, there's no surprise charges to you. This is just, I'm not going to go through this busy slide, but this is just a list of some of the preventative services. And again, this was what was written by the government. So you'll notice, for instance, about halfway down on the left side, it says for ages 40 to 70. Now, that's not to say that there aren't some students that are of that age, but it's not a typical college age program. So you'll see that because this was written for all folks, not just college, you'll see that listed there. But you'll also see some things that your annual physical is covered, HPV is covered, influenza shots covered. So these are STDs, things that, you know, may come across in your college experience. Might have worded that improperly, so maybe speaking for myself. Sorry about that. Regarding prescription drugs, this is something obviously that's usually a very key thing within student health plans. You know, we've found, like I said, I've been doing this for more than 15 years. We've found that there are a lot more students that can attend school now that couldn't before because of particularly mental health and behavioral health drugs and such. This gives you a breakdown of what the co-payments are. And again, I mentioned that earlier, you just pay that flat amount and then it's covered for you. Any of the preventative things or diabetic drugs are covered at, we're calling it tier 0 because it's $0 to you. Generic is the next tier, that's a $20 copay. Preferred brand name is $40, non-preferred brand name is $60. And then specialty drugs, and these are the really complex, expensive, long-term pharmaceuticals. They are $100. And you can also, I'll show you the website. I mentioned you can look up doctors on there that are participating. You can also look up generics or substitutions for particular medicines you're taking. If you're not familiar, generic drugs are when brand names have gone off patent, they're able to produce them more cost effectively. So you're basically getting the same medication for a lower cost. Pre-existing conditions, this again was something that could have been not covered in the past. they are not excluded under this plan. So you would have coverage for these things. So I want to make that clear. But, you know, with the political landscape, it changes sometimes during these times. Talk comes up whether it should or shouldn't happen. I'll tell you, there was a time when pregnancy was considered a pre-existing condition, if you can imagine that. I don't think, given where we're at now, any of that would go away. So just to be clear, your University of Maryland student health plan does not exclude pre-existing conditions. There are some supplemental coverages that are available. So there's vision coverage for children. There's vision for adults. There's vision for children, and dental for vision, and then dental for adults as well. You can go to My AHP Care, so My and then AHP like Academic Health Plans Care, care.com/benefits to look at these. And then also I'll give you the specific, it says UMD here. That actually goes to the undergrads. So you could either go to UMD SHIP, like Student Health Insurance Plan, .myhpcare.com, or go to umdgrad.myhpcare.com to get your specific benefits as graduate students.
Excuse me, Dave, this is Debbie. I have a quick question. Will we be able to share these slides with the students so they can refer back to this after the workshop?
Certainly.
Terrific. Thank you.
Yeah, no problem. And let me know if I can't see what time it is. Let me know if if the time's going okay, please.
I sure will. It's 1 o'clock now.
All right, perfect. So telemedicine, this has obviously become a big issue in the COVID-19 world. It's something that was an emerging trend in student health, but it was growing, but it was still a very small percentage. Obviously, whenever possible, you want to go to the UMD Health Center for the best continuity of care. But the UMD also wants to make sure that you can get feel comfortable getting the services that you need. So there is video visits through Care First, and those basically start at, there is a small cost that's associated with it, but it's capped at $49. That's the most you would pay. So you can do that conveniently, and very important in today's world to be able to see someone virtually. So that is an option that's available to do through Care First as well. We talk about open enrollments and qualifying events. So there is an open enrollment period at the beginning of the year that you can choose to sign up for this plan. I know there's some other plans that are available to you. I wish I could do a head-to-head comparison for you, but you know, I wouldn't want to. We have to somewhat we have to remain impartial to some of these. But hopefully with these slides and the information that we're going to provide, you'll be able to look at it and see what works best for you. Usually you're given at least a month to enroll. Typically you get a little longer with UMD historically. And then a qualifying event, if for instance you are very typical on your parents plan and you're 25 years old, and that's great, but at age 26, you can no longer be a dependent on their plan, and that seems to happen in the middle of a school year or some random time during the school year. That is what we call a qualifying event. Because you lost coverage, you do not have to be in the open enrollment period to be able to sign on to the plan. So we do give you 30 days to do that. There's some other things that are listed here. If you get married or divorced or adopt a child, things like that, coming into the country, there are qualifying events, and you can certainly talk to Robyn, or I can work with you to be able to make sure that your needs are met there. Important health documents. I heard about this, some of the exciting life hacks you have coming up next week. So my health documents aren't nearly as exciting, but important enough to take a look at. Obviously your ID cards is an important thing. So that's what it looks like to the right there. An example kind of calls out what that is. You can sign on to the Blue website, and you can actually get that. I can print it from your screen, or there's actually a mobile app that you can sign up for, and that way you can get it on your phone. Be able to get it that way. So there's a few different ways to be able to get it. Obviously, you can get a hard copy mailed to you as well. If you want to call us, and the numbers at AHP at the number at the end, we can get that to you if that's the way you want to go about it. But there's a few ways to have that, and it's obviously important to have that with you if something happens to you. The summary of benefits, that's really just, we call it a benefit grid, but it basically is a sheet that you kind of look down and it says this benefit, in network, out of network. That's very helpful in looking at easy guide to be able to see what the coverages are. So that pertains to what your benefits are, so you can research those. The explanation of benefits is actually the summary you get after you've received benefits. So we mentioned that, you know, there could be a deductible, say on the first couple of claims of the year, or first claim of the year, and then there's co-insurance. So this explanation of benefits breaks all that down for you. It also has a counter on there that would let you know, how much you've paid towards your deductible and what have you. I would always advise folks to access one of these, whether it be electronically or you have it sent to you prior to paying any bill that was sent to you by the doctor. The reason I say that is people are certainly well-meaning out there, but sometimes billing services either aren't sure where to send it or might send it to multiple places. And your Blue Cross providers, they actually contract a much lower rate. So that 20% is 20% of a contracted rate that you would need to pay. So I would wait to find out what that is before you pay anything there. And again, your accumulators and things for what you've met up to your out-of-pocket maximum that I mentioned at the beginning, that would cap benefits as well. This is your master policy. So this is not just the short snippet of what the benefits are. This is the full insurance legalese. If you get through 4 or 5 pages at a time, you're doing pretty well. No, I'm only kidding. It's valuable information, but it's not in the most user-friendly format. It's more of a legal document, but this includes all your exclusions. This is what's approved by the State Department of Insurance and what's filed there, and it details every bit of the coverage. That's just a quick explanation or picture of what the cover, an example of what the cover page would look like, but it's usually a fairly long document. So I think I went through things fairly quickly because I know we started a little bit late, but let me, if I could, get out of this and share this with you. Can you see that, folks?
Yes, it's the umdgrad.myahpcare.com.
Perfect. Yeah. So this is the actual page, just a screenshot of the actual page you'll go to get your benefits. If you go to UMD SHIP Student Health Insurance Plan.myhpcare, you'll get a landing page and it'll say, are you a grad? Are you an undergrad? And you just click grad and it'll bring you to this page. So this is the website that AHP has created for UMD, and this is specific to the grads. You'll see right here, this part, the red part that I'm circling here, that is the most up-to-date information from CareFirst or from Blue Cross regarding COVID. So you can click right on that. I can't click on it because this is a screenshot, but you can click right on that and get that information. You'll also see some of the quick links over here. This is going to be on every page to the right. This is where you'd find a pharmacy. You can change your address, email here, get an electronic ID card. This is where I mentioned if you're looking for a participating provider, you'd find provider or hospital here that is located within the, or is a Blue Cross provider, you can get that better level of benefits. This is how you can request a hard copy ID card. You can get an account here. So just, this will follow you some quick links if you need. This is a tab you click on as well, right under the Care First logo, benefits. That's going to give you both the grid that I mentioned and that full master health policy. And then cost, that's going to explain to you the cost, the breakdown between the semesters, all that stuff. Enrollment, this would be if you wanted to enroll on the plan. Also, if, as Robyn mentioned, if you have a plan somewhere else, whether it be with a spouse or outside employer or parents, what have you, you would go here to put in your information, because the grad school is gathering the information for the people that do waive out. So if you could do that and help them, that would be very, that they would appreciate that. Excuse me. It goes to this page. So if you're, so this is the enrollment if you want to get in. My apologies. I put them together. This is a little set up a little differently for the grad students. This is if you already have insurance. If you could please share your information there. I guess we made it fairly simple. Already have insurance. Claims information. This will give you the contact to be able to view that if necessary, or get to the right spot. Also, claims would be a Care First piece. The contact information will have contact information for both academic health plans and Care First. I would suggest, to make your life easier, you call us directly at AHP, and if need be, you need to talk about claims, we can call them for you and do a little warm transfer that way. So just want to show you the basics of what that looked like as well. And hopefully, yeah, I've left a little bit of time for questions too, if need be. That's my story, and I'm sticking to it.
Sounds good. Thank you so much, Dave. You provided a really good baseline for us to take questions now. Robyn, I know you've been answering some questions in the chat. Is there anything that you were unable to address that we should share with Dave now?
Let's see. I'm not sure if I missed a question. So if
Okay.
as you look through all those questions and you see something that does not look like it was answered, please let me know.
Okay.
But
So
I'm sorry?
did you answer the question about there's some of us will be joining in spring of 2021. Will enrollment be open at that time?
Yes, enrollment for SHIP is open for spring 2021 starting January 1st. There's a spring open enrollment January 1st through February 15th. So if you're here for this, if you're physically on campus in the spring and need insurance, SHIP enrollment is open.
There's another question. How do we opt into the Maryland State Employee Plan? And please explain what opt-in means.
Okay, thank you. So the Maryland State Employee Plan, just to make sure everyone is on the same page of this, is only eligible for graduate assistance. If you hold a 9-month, a 9.5-month, or a 12-month graduate assistantship, you are eligible to opt into the plan. You don't have to opt into that plan. You can choose a different plan. But as a GA, graduate assistant, you are eligible to opt into the plan. I'm told that once you are an active GA, you will start to receive emails from the state of Maryland to provide you with information about how to opt into the plan. If you have not yet received any kind of communication from the state of Maryland, I would say you should probably speak to your department's business office, or you can contact our Human Resources Department directly. In the chat, somewhere up there, I did provide a link to the UHR benefits page, UHR meaning University Human Resources. So if you look in the chat a little further up, probably maybe 15 minutes ago, I added a link. I believe it's uhr.umd.edu/benefits. And that provides you with basic information about the state plan. And if you also navigate through that page, you should be able to find contacts at the UHR office to help you with those kinds of questions. So it's a state plan, so it's really run by the state. The state, you know, once you're an employee, as graduate assistants are, sort of, but in any case, you are, one of the benefits of being a GA is that you are allowed to opt into the employee plan. I hope that helps to answer, because I don't manage that process. I don't manage that enrollment process. It's all done by the state.
Okay, Robyn, another question. Where can the brochure of SHIP be found?
So, yeah, and Dave, it looks like he was going to say something, but
Okay.
Did you want to answer that, Dave, or you want me to?
You know what? Let me bring it up.
Okay.
Well, the short answer is go to umdgrad.myhpcare.com and click on benefits. But I'll bring it up to show you what it looks like.
And I'm going to put the link in there. Grad. UMD grad. Oh, I got to find the link better than that.
So let's see, can I go back to sharing my screen? Is that sharing now?
Yes, it is.
Perfect. So this is the actual, so I had a screenshot before, but this is the actual page. So we saw UMD grad myhpcare.com. .myhpcare.com. If you click on benefits, there's the plan highlight flyer. This is a quick snippet that will give you a little information. And then the second page is like that grid that I mentioned. Sorry, it's a little difficult to see on here, but you can print this out too and look at it. Obviously zoom in when it's on your computer. And then oh, my apologies. The big one that I mentioned is not available as a link yet, the master policy, because that has to be filed with the Division of Insurance and approved. So that should be up there shortly. Certainly if you have any questions, feel free to call us, but this goes into the benefits that I mentioned, the plan highlight flyer.
Okay. Here's another question for Dave or Robyn. It says, I believe I am a 9-month GA and qualify for the benefits, but is there a way for me to verify this now? I have not received any communication from the state yet.
I would say speak to your department's business office. They can verify for you what kind of position you have. If you're being called a graduate assistant, most likely you are in fact going to be eligible. There are probably some people that refer to a graduate assistant that really are hourly appointments. So that's what you need to clarify. Are you in fact a graduate assistant or are you hourly? My guess is because you've used the terms 9-month assistantship that you are in fact a graduate assistant.
Okay,
But like I said, your business department will be able to, or your department in general will be able to verify that for you.
Okay, thanks, Robyn. Here's another one. When selecting a plan, it shows an employee cost monthly 10 and employee contribution monthly 10. What do these costs mean? Are they the amounts the student would pay monthly or annually?
Is that person talking about the state plan? Or?
Maria, do you want to unmute and clarify your question?
Yes, thank
please?
you. Hi, so I'm wondering about the benefits that come with the graduate assistantship. So
okay.
if you opt into one of these plans, what are these prices that the website shows what the student would pay on a monthly basis? Or
so are you on the UHR website that I posted earlier?
I'm on the My Workday stated.
Oh, the My Workday, okay. So, which I'm not familiar with that particular site. I know about it, but I've not been on it. So, so you're asked, does it show a bi-monthly or a pay period amount that you're responsible for?
If I select one of the plans, it shows like one of the sections in the graph is employee cost, and then in parentheses it says monthly 10. So, and then next to it, it says employer contribution.
Mhm.
And
Okay, so the employee cost is your cost. The 10 that you're referencing is talking about the 10-month pay periods. So if you're a 9.5-month employee or a 9-month employee or graduate assistant, that 10 is referencing that basically the deductions will occur over 10 months of period of time, not 12.
okay,
That's what the 10 means anyway.
okay, thank you.
Okay, thank you. I have another question, and it's a specific question. It's regarding estimates given by doctors, and in this case, the dentist. And the student says, if I am given an estimate of services where the dentist gives the code for the treatment plan and the respective charges of what the insurance will pay and what I will have to pay, is that set throughout other dentists? As in, if I went to another dentist's office and asked for their estimate, would it be the same since the estimate is taken from insurance?
Dave, do you want to attack that one?
Not really.
Do you need some clarification,
No,
Dave?
well, I think at first, the school doesn't offer a dental plan, correct? Or do they have one for the
No,
grad?
there is an option to purchase a dental plan through
Okay.
SHIP.
Thank you. So, yeah, I would say the benefits are not going to change from what the carrier quoted, but a different dentist might submit it differently. So it's a tricky one. Whereas, I would, if you're going to get multiple opinions, I would have them go through the process, just to make sure, because it could, depending on timing of when it's submitted, it could depending on location. If you're going to, if you're on school versus home in a different state, there could be different reimbursement rates there. So, yeah, to be cautious, I wouldn't trust it for multiple dentists.
Yeah, I wouldn't either. And I think with regard to dentists, they themselves will charge, for example, say they charge $100 for a service. The insurance has said that they'll pay $75 towards that $100. That's just an example. But a different dentist might charge $150 for that same service. And still the insurance will only pay $75 towards it. So you really have to, and then there's in-network doctors versus out-of-network doctors, and that might also play a role. So you need to get if you're going to be shopping around on dentists, definitely do the whole 9 yards and get the estimate from each dentist that you want.
Yeah, because that was my biggest concern. You brought up a good point, is are they going to balance bill then for that difference in the cost if it's not a participating dentist? So it's just, I would exercise some caution, although I think in the same geographic area, the reimbursement would relatively be the same.
Hey, sounds good. Thank you, Dave and Robyn. Here's another question. Okay, the student says, I would appreciate if you could explain how does the SHIP plan work for pharmacies and prescriptions? I had a prescription and had to pay, so can I be reimbursed?
So let me just, I'm assuming it was something recent. So if, say, you went, you started school in August and for whatever reason you didn't have the card yet or something, and they made you pay out of your pocket, if you're active now, we could go back and reimburse you for this year. So I guess you can tell me if that's not the case, but yes, you could submit for reimbursement if you had to pay out of pocket, assuming it was a covered prescription. But from not moving forward, if you have your card, you should only have to pay a copayment.
So hello, yes, I did have the card, and so I was charged for it. So based on what you said, it seems I'm eligible to be reimbursed.
Yeah, as long as it was a covered service. I'm not, I don't want you to tell me what prescription that you got, but sometimes, I had a rash and they wrote me a prescription and they didn't pay for it because I could get it over the counter. So there are some things that happen like that, but for the most case, yeah, if it was something that, or for all cases, if it was something that was covered, you should get reimbursement for it.
All right, thanks, Dave. Here's another question. Do you or Dave or Robyn know of any resources or any tools that could help a student kind of compare plans? Or do they have to kind of just figure it out as they go along and review their choices?
Yeah, we last year, and for the AY 1920 academic year,
Yeah.
we had provided some sort of cost compare sheet. It's like a one-page cost compare. It's last year's prices, but it's basic comparing. It's only one page, but it's got some highlights on there.
Mm-hmm.
I can share that. That's fine. Just know that it's last year's prices and last year's plans. So there might be some changes from this year plans. So I'm happy to share that. I can do that. It might be online right now, so I'll put the link in the chat if I can find it.
That would be great. Thanks, Robyn.
Add to that for a minute. I think some of the key things to look at is obviously the cost that she mentioned, but look at the deductibles. Like a lot of I'm not sure about the Maryland state plan, but a lot of the exchange plans are high deductible health plans. So the premium might look advantageous, but you're paying a lot of money up front on the deductible. The co-insurance, really the things that, I'll make these slides available, but really things at the beginning, if there's an out-of-pocket maximum, that's a key thing, because that's really that peace of mind that stops you from having to pay tens of thousands of dollars out of your pocket, God forbid, if something happens. So a couple of key things to look at.
Okay, sounds good. Here's another one. Would you be able to explain a bit more about how the prescription-specific additional insurance works and whether that is something that most people add, or is it often redundant?
I think this person might be talking about the state plan because the state plan offers some sort of CVS prescription service. Like, since he mentioned CVS, I think that's what it is. And what I can say is that it's probably not redundant. I don't know enough details, but most people who know they're going to need prescriptions will get a prescription plan because that way, when you pick up anything that you need, it's just a copay. So most people get the prescription plan. I guess is how I can best answer that. If you don't have the prescription plan, you will not have much of a benefit when you buy your medications.
Okay, thanks, Robyn. Someone is asking which plan provides the best coverage for specialists. They're having an issue that might be serious. So is there an easy answer to that question?
I don't know that I have an easy answer. I can only, I guess, address what I'm representing here. And the University of Maryland plan for students does not differentiate between, we'll say, primary care physicians and specialists, meaning a lot of plans now charge you more as a copay what have you, to go to a specialist. That's not the case here. I'd also say that the Blue Cross network is very robust. So there's a lot of specialists that are in network. That's, I guess, the most information I can give from my end. But I would say go and look up and see if you're going to a particular provider, or you can look it up by provider type. If you need a dermatologist or what have you, you can type that in and see who's in your area. If there's someone that you've been recommended to, or someone that, you know, your family recommends, see if they're available, and that would be more cost effective for you as well.
Yeah, I think there's oftentimes you'll see insurance plans will charge for the primary care physician, they'll charge $15, but for a specialist it'll be $25. That kind of thing is often said. But the one thing I wanted to make sure that everyone understands is that the SHIP plan and the Maryland State Employee Plan are very comparable in plans. There are some differences, but overall they're pretty comparable. They're both premium plans. They're both really excellent providers. Carriers is the right word, meaning Blue Cross Blue Shield. Care First, right? Is that what we have, Dave, for a SHIP? Okay, so the university student health care plan is Care First, and that's a reputable carrier. And it's a premium plan. It's a good plan for a reasonable price. So there's no doubt that whichever one you choose, you'll still have good insurance. There's small differences, but you will still have good insurance.
All right, well, it's 12:30. I'm sorry, 1:30. And does anybody else have, we could squeeze in one or two more questions? Is there anything else? All right, well, we're not getting anything else in the chat. I'm getting a lot of thank yous in the chat to you, Dave and Robyn. Thank you so much for demystifying a really complex topic. I know students don't have much time before they have to make a decision. They may have ongoing questions. If they have other questions, how can they get in touch with you, or how do we get them you know, some more support beyond this?
Do you want to compile those, Robyn, and send them to me if that's the case?
Sure. I just posted something in the chat, which is our basic insurance, our graduate school website health insurance page that is just sort of our go-to place. There's some frequently asked questions on there about GA ships and insurance and things. Some of the things we mentioned here today, and some of them we didn't. So you definitely take a look at that website, read it through, see if if it creates any additional questions. I'm always here for, someone can always email me, and I can, you know, either answer or redirect to help you get your answer. I don't know, do you have any other suggestions, Dave, in terms of resources?
No, I mean, certainly look at the website and you know, see what's available for you there, and compare the two, whatever works best for you. You know, we want something that fits your needs. So, yeah, that's.
So Debbie, you have a list of everyone's email address from the registration, I assume, right?
I do, yeah.
I can try to gather up some of the, you know, just attending this, remembering some of the things that were talked about. I can try to gather up a resource page or a question and answer kind of guide based on today's session. And we can share it with people.
That'd be great. We will be posting all the resources from this workshop on our website as things become available. So you just go click on the workshop tab and look for this workshop, and you'll find all the resources listed. Great. So thank you so much, Zach and Dave and Robyn. This was a good way for you to spend your hour supporting our grad students. So thank you again. Take care.
Thank you for having us. Next week, life hacks.
That's right.
Enjoy it.
Thanks, Dave.
Right.
Bye.